Thank you. I'd like to spend a few minutes, excuse me, talking about, as we transform the face of the medical center, how we're trying to do it mindful of recycling and reusing existing locations. There are three major on-grounds developments. The Emily Kirk Cancer Center, which is replacing the West Garage, expanding the front of the hospital without taking additional space, and the West Main Street development, including the Children's Hospital. Next, please. As we move further west to the Northridge grounds, which are familiar to people, we intend to add a long-term acute care hospital here. This is a 40-bed hospital specializing in the needs of special patients who need to be in hospital for at least 25 days. So we will also be adding onto the Mosier Radiation Center a second vault so that we consolidate some of our radiation center activities here on site. In addition, we will be adding a considerable amount of landscaping across the entire site and extending a stone wall that you see further down the road, all along the front of the site. If anyone recalls the West Garage, which was there as of April, we've now started the construction of what will be, I think, the front door of the finest cancer center in the country. This is very different. As you see, it's entirely glass front and side, bringing natural light into the building. All of the spaces are public in that area. So we're trying to bring as much of the nature and natural light into the building as we can. There'll be a rooftop garden for patients and family to escape from the stress of being patients in their disease. And we're trying to make this building as comforting for those patients as we possibly can and for their families. Across the street, this is showing what the Lee Street will be at the end of the project. We'll go back and we'll look at the hospital bed expansion. But we're trying, thank you. Start. You got to go back to the hospital expansion. Thank you. Coming next March, there'll be a crane in front of this building, which will allow us to add this front extension onto the hospital without taking any additional space. We'll be adding 72 new beds to the hospital. 6 12-bedded units. All of these will be 300 square foot private rooms. All will have full glass fronts. These are designed around the patient and around the family. So this will be a significant increase in our patient rooms, but also allow us to go back and take the other rooms in the hospital and upgrade those to the needs of not only medicine, but to our focus on patients and families. No. This is showing a connecting element. What we are trying to do is develop a bridge along the second floor of the hospital connecting all of our buildings so that patients and visitors will be able to traverse the entire medical center above grade. So this new enclosed bridge will connect the hospital to what we call the mixing box, the East Garage, the Cancer Center, or this new, now the 11th Street Garage, and in the future beyond that into the Children's Medical Center. And this is what we hope the center will look like as we look into the future in 2012, 2013. The new cancer center, the expanded hospital, Children's Hospital over here, and a center core that focuses on the attention of patients. As our patients and visitors come down, they will see they've now arrived at the University of Virginia Medical Center. And all of these essentially are rebuilding on existing sites, trying to rebuild rather than take up new spots. One of the evaluation we did was, should we build a new tower here? And I think working with David's office, the logic of extending the existing building and reusing that made a lot more sense. Thank you very much.